Well, good afternoon, folks. Welcome to Public Health Research Day, College Park campus, and I think we'll go ahead and get started, knowing that a few more people will probably trickle in. And thanks for being here. We want to welcome everybody and know that we're going to keep this a little bit informal. We have a modest-sized group. Feel free to move up. We've got plenty of seating in the front. I don't know how that always happens. You know, this is I said before some talks, and I'll say it again, this is not the aquarium where you have to worry about the splash zone up here. We will, you know, this is a safe area. You know, I've only got a little bit of drink here, but this is safe, and feel free to populate these forward seats. And so let's go ahead and introduce ourselves. Let's go ahead from the end here, Dr. Blattner.
Okay. I'm Professor William Blattner. I'm in the School of Medicine, in the Department of Medicine and Epidemiology and Public Health. I have a number of titles. I'm Associate Director for Population Research for the Greenbaum Cancer Center. I'm head of the Division of Cancer Epidemiology. I'm co-founder and Associate Director for the Institute of Human Virology and head that epidemiology division as well. So I keep pretty busy trying to remember what I'm doing.
My name is Joanne Dorgan. I'm a professor in the Department of Epidemiology and Public Health in the School of Medicine in Baltimore. I am a co-leader of the Population Sciences program in the Greenbaum Cancer Center with Cheryl.
Thank you. And I'm Cheryl Holt. I'm Associate Professor in Behavioral Community Health in the School of Public Health here at College Park. So thanks so much for being here today. And I'd like to get a sense of who we have in the room. We've got a number of folks here with us. Folks from Baltimore campus. Oh, wonderful. So great to see the cross collaboration with the two campuses. Folks from College Park. Okay. And I see some uniform folks in the audience. All right, wonderful. Thanks for representing. Other folks from other places in addition? Okay, fantastic. I know we've got some folks from other universities around the area, so glad to have you with us. We don't want to sit here and just shoot out slide after slide after slide. We really want to make this an interactive discussion. We want to involve you all and operate that way. We know it's post-lunch, so we don't want to have everyone closing their eyes. And so we do have some slides to kind of structure our talk today. But I think what we want to do, so we've all been really intimately involved with the new program in the Cancer Center that we'd like to introduce to you and get you familiar with and kind of roll out. And so we want to talk about that today, our program in population science research in the Cancer Center. So this is how we can structure the talk, but we want to encourage you to jump in, ask questions, interact, want to get a sense of why you're here, folks with interest in cancer research, folks who may have active cancer research programs, how we can work together, let's do some networking. So let's make this, a useful session as well. So we want to talk a little bit about the Greenbaum Cancer Center located up in Baltimore, the Cancer Epidemiology Alliance that was the foundation for our program today. Introduce you to the cancer control and population science program, and talk about some upcoming opportunities that we have to involve you in the program, as well as have a discussion of some challenges ahead that we're looking at and trying to think about how we're going to work through some things that we're looking at for the future. So I'm going to pick on folks, my co-presenters, and so I'm not doing all the talking. Maybe for these first few slides, I'll pick on Dr. Blattner to give a little bit about the Cancer Center, how long it's been around, just kind of what's the what with the Cancer Center.
Okay. It's okay. It's easier to see from not being blinded. Okay, so by way of background, when I started my career in the Public Health Service in 1973 at the National Cancer Institute, it was during the Nixon administration. and the war on cancer was declared. At that point in time, the field of medical oncology was just beginning, and I am a board-certified medical oncologist. And so I joined the National Cancer Institute and spent 22 years there doing cancer research, particularly in the area of viruses and cancer. But at that time, there were really very few treatments for cancer, and there were very few centers that were providing cancer, basically Sloan Kettering, MD Anderson, a few other places that were kind of cancer centers. And at that point, often I think they were dealing with death and dying as opposed to healing and curing and treating and preventing. And so out of the war on cancer that the Nixon administration put forth, there were a lot of advances that took place, and they developed as a first stage trying to make centers of excellence that would become available to populations around the country, so that you didn't have to go to New York or to one or two places. And so as part of that process, they developed different designations of cancer centerness. And so the highest level cancer center is a comprehensive cancer center, and it engages basic research, clinical care, and population research, which is a very broad term, which I think we'll be going into in greater detail. And so the Greenebaum Cancer Center is a designated cancer center. It's doing cancer research and clinical care, but until now has not been designated as a comprehensive cancer center. And so the goal that we're working on in our partnership between the founding campus in Baltimore and the College Park campus and the School of Public Health and other schools is to build a bridge of population research that takes advantage of all of the expertise to take this cancer center to this next level. And so it's this cancer center is one of the 68 now designated cancer centers. It was designated as a cancer center in the NCI paradigm approximately 8 years ago. So it's a fairly new cancer center. It's relatively small by comparison to MD Anderson or Sloan Kettering or some of the bigger centers, but it's a very vital resource to the state of Maryland since it serves as a tertiary center of excellence, but it has many primary and secondary cancer programs that are on the Eastern Shore, serving some of the underserved populations. We've had relationships with University of Maryland Eastern Shore, for example, to reach out to the populations at high risk. So that's a little bit of the background and framework for some of the discussion.
Great, thank you.
Okay.
You can
So
really
I'll
continue.
go ahead with
You
this?
can- Yeah.
Yeah,
Yeah,
okay.
next
And
couple
so the existing programs that are in the cancer center, and when you have a cancer center, you have programs that target different areas, but there's an important component of cross-disciplinary interaction. So experimental therapeutics is what it should sound like, although it became somewhat of an umbrella organization over the years, is where the translational research is taking place, where new drugs are being discovered and new therapies, and they're taken into small clinical trials called phase 1 and then later into more advanced trials. The program in hormone-responsive cancers is really one of the great leaders in this field of hormonal cancers. The discoverer of the aromatase inhibitors, which is one of the great advances in breast cancer therapy in the last 5 to 10 years, is the lead scientist in this program. And we were fortunate to recruit Dr. Dorgan from Fox Chase, because she's a world leader in the epidemiology and molecular epidemiology of molecular. I think the battery ran out, maybe. molecular epidemiology of breast cancer. And so she's working cross-discipline with these basic scientists in that field. Molecular and structural biology is an emerging area of cancer research because we're moving towards what's in the old days called the silver bullet, where one can have a drug that goes in and hits a very specific target. Some of the older cancer therapies and radiation therapy were basically like aiming a howitzer at a flea, so to speak, because you had significant toxicities for many different cells in the body. And so one of the hopes of this molecular structural biology is to be able to understand exactly where the cancer cell has gone wrong and to give a drug that can correct that. And there are some very specific examples where through the understanding of the structure, specific small molecules that go in and change the course of the cancer can really lead to cures. And so that's somewhat the future of cancer research, and it very much ties in with population research from the point of view that we're moving towards a period of what's going to be called personalized medicine, where you go in, your tumor is biopsied, they do a genomic analysis of that tumor, they see where the defects are in that tumor, and then there will be drugs that go after specific pathways. And eventually, just as we're working to try and cure AIDS, we want to get to the point where we can be smart about how to treat and cure cancer. The tumor immunology and immunotherapy program has a similar mission. One of the things that we've learned recently in cancer research is that the immune system is immobilized against the cancer cell. The cancer cell is really a foreign cell, but what the cancer cell has figured out how to do is to use some of the systems of the body to surround itself in kind of a cocoon so that the immune system does not see the tumor, and that's called the microenvironment. And so there are strategies that are now coming into play to develop therapies and interventions such as vaccines, therapeutic vaccines, to overcome some of these barriers. And maybe in the future, there will be preventive vaccines in this field as well as we go forward. And so the viral oncology group has to do with the fact that about 20% of cancers are caused by infectious agents. And these can range from leukemia viruses to viruses that cause lymphoma and cervical cancer and a whole range of tumors, as well as bacteria that can cause stomach cancer, for example. And so what happens with these organisms is that they come in and they take over and subvert the body's normal systems through genes that they insert into the body. And so cancer control and population science, you're going to hear more about, is really the glue, in a sense, that ties this all together. And you'll hear more about the details of that in subsequent slides. But it's a very interesting congruence of public health and basic science that really holds the key. And I think that's what our leaders are focusing their attention on. One more? Okay. Yeah, okay, good. Okay, great. Okay, so the background for this program began a few years ago when Dr. Cullen asked me to help bring us to comprehensive status as the head of this population research activity. And so we established this division of cancer epidemiology in the Department of Public Health, Epidemiology and Public Health, which is a department in the School of Medicine. It's a very active and highly productive department, and many of the faculty are here. And we went about recruiting some key recruits. We recruited Clement Adamamowo, who is an international global health expert. We recruited Joanne, and we're in the process of recruiting additional faculty. And if you know of any good people out there who are interested, please send us your resumes. And so about the time that I got involved with this, there was this effort by the legislature to collapse the Baltimore and College Park campus into a single entity to save money. I guess that was the main idea. But then cooler heads prevailed, and the chancellor and the presidents and so on got together, and they came up with the Empower initiative. And so this particular forum, in many ways, is a fruit of that Empower activity, which is to really harness the intellectual capital that exists on this campus and in Baltimore, so that we're pulling together to create strong, mutually beneficial programs. And so at that time, Mei-Ling Ting Lee was the head of the Department of Epidemiology, and so I got in touch with her, and we came up with the idea of what we called the University of Maryland Cancer Epidemiology Alliance, which we tried to interest the Empower folks to think would be a good idea. They never heard of us, and I don't know that they still know about us, but I'm kind of a bulldog when it comes to this sort of thing, and so I kept going, and she kept going. Through that, we identified a lot of people who are very productive cancer researchers between the two campuses. And we started having meetings and so on and so forth. And then last fall, we had a meeting of the External Scientific Advisory Board for the Greenbaum Cancer Center. We presented a model of what we had pulled together, and they said, well, you should really go forward now with a population research program, because that's how it's done in cancer centers. We can't have a distributive model. We need to have a focal model. And out of that, Dr. Cullen nominated and identified Dr. Holt and Dr. Dorgan to be the co-leaders of this. So UMCEA was kind of the bridge from nothing to now a population research program that you'll hear more details about. I don't know why I'm making this noise. I guess there's a loose wire. That's why the tape's on there. Okay. So you want this back? You're going to sit or stand?
Oh, I'm going to sit. I'll sit.
Okay. Whatever
Great.
works for you.
Okay. Okay. I think we've kind of gone through this already. The idea of moving from the clinical cancer center to the comprehensive status. So thank you, Dr. Blattner, for taking us through the history and kind of bringing us to where we are now. Great. So maybe I'll pick on Joanne next to go
want me to
through.
talk a little
Yeah. Do you mind?
No,
Kind
I
of
don't.
going through. Okay, great. And we've got our moving microphone.
Yeah, I know.
It's hard to see the slides when you're sitting there.
Actually,
so,
it is. Yeah.
Move this down here so you,
Okay, great.
moderator, have a...
Okay. Okay, so just as a introductory comment, this is all very new. Cheryl and I have just been working on this for about a month now, so everything is pretty preliminary still and is very fluid, and things will probably evolve over time. And if you all have any suggestions, we're more than happy to listen to what you have to say and try to incorporate your suggestions. And so, okay, so we have a couple themes that our program is organized around. And which one is it?
This is the advance, but you got to point it to the...
Oh, okay. The first is to identify social, environmental, and physiological determinants of cancer-related health behaviors, to inform novel strategies for cancer prevention and control. These are actually a little out of order.
Yeah, I didn't realize they'd fly in like that.
The next
I
is to
actually don't know
develop
how
and
to do that.
evaluate behavioral cancer control interventions, particularly in underserved and disadvantaged populations. Hopefully our first will come up now. There it is to identify behavioral, social, environmental, and molecular factors associated with cancer risk and outcomes, with the goal of decreasing the burden of cancer in the U.S. and globally. We have 35 members currently, 19 on the Baltimore campus and 16 on the College Park campus, with over $10.8 million in cancer-related research funding. And we've been contacting people, and if you haven't heard from us and you're involved in cancer research or are interested in becoming involved in cancer research, we are recruiting members. One of the things I was doing here is I was going around posters and finding people who are doing cancer-related work and identifying people who I can contact if they weren't sitting at their or standing at their poster. So we'll be contacting you, or contact us, please. We are organized into 3 clusters, research clusters currently. Behavioral sciences, which Cheryl leads, epidemiology, which I'm leading, and pain and palliative care, which is currently being led by Susan Dorsey in the School of Nursing. Within behavioral sciences, we have 3 foci of research. One is on smoking, early detection, and as well as on prevention. In epidemiology, we have research looking at genetic and molecular epidemiology, viral epidemiology, outcomes research, as well as global health. And in pain and palliative care, this one was just added yesterday, so pain and palliative care just has pain and palliative care so far.
If you have something you want to add, you want to see us.
We're flexible. Within the behavioral sciences program, early detection focus is primarily on underserved populations, and currently there are efforts in screening in breast, prostate, and colorectal cancer. The prevention activities include research in bioactive food components, physical activity interventions, and vaccines, particularly the HPV vaccine uptake, as well as in smoking, and these are all coming in different order than I'm expecting. So, and smoking, the research covers the areas of addiction, smoking cessation interventions, and finally some work on the new e-cigarettes.
Can we pick on Pam?
Does Pam want to say something about her program project, Grant?
What's the word on e-cigarettes?
Well, I'm really torn on it. I mean, they're a real problem. There are some people that use them with smoking. So how can you just say you can't use them, we're going to take them away from you? You know, but it could be something that could help some people. On the other hand, it's re-glamorizing and re-normalizing smoking. So something that hasn't been on television for several decades, now back on television as glamorized. You know, it's just the real kids are taking them up, you know, at a very rapid rate. And there's a subculture of vapors, those who vape.
Well, I was talking to somebody the other day about this, and he was explaining to me that it's not all nicotine, that you can have these vapors. He says he uses just menthol, and so he thinks he's fine. And other people were saying that they put other substances in this delivery system, I guess is what essentially is.
Yeah, and now they're highly flavored, and the little refillable containers of nicotine is enough to kill a 2-year-old. And they're not childproof or anything, and they're soft plastics. The dog bites that, the dog's going to die. I know you feel worse about that than a kid, right?
So that's a developing public health issue, and worse than I even expected. I had not heard about how toxic they are, that a child could die, or a dog, cat. So we're going to go on, but thank you for clarifying that for us. Within epidemiology, we have in genetic and molecular epidemiology, we have ongoing work in SNPs and GWAS. We have quite a bit of work going on hormonal determinants of cancer, as well as some new research using metabolomic strategies and the microbiome. In the outcomes, we have research ongoing in obesity, cost-effectiveness research, as well as some new efforts we're putting together. Several of us have recently put together a grant to look at disparities in cancer outcomes. And I think you have that, yeah. And within the viral epidemiology program, we have HIV-related malignancies, as well as HPV-related malignancies, particularly cervical cancer. And finally, we have global health. And, oops, you took that one out. Global health, which is in collaboration with the Institute for Human, does it come by later?
It does.
Oh, Cheryl organized the slides, sorry.
I mean, disorganized.
The animation just kind of got.
I was just about to ask if we missed anything.
We're, okay, so I'll talk about global health in a minute. It's coming up. So within the, some of our upcoming activities are monthly seminars. They start on April 21st. We'll also have annual retreats. Ours will be in mid-June this year. We're still organizing that. We're trying to develop opportunities to foster collaborations within our program, between programs, across campuses. And a couple of the requests we've put in for some funding are for pilot studies to incorporate biomarkers into behavioral research studies to integrate more of the basic sciences with the behavioral sciences, as well as a proposal to provide funding to extend the behavioral interventions that are currently being done in Prince George's County by the behavioral scientists here into the Baltimore area. And we also have requested funds for studies, for pilot funds to support developmental research, to support development of R01s. And so we've put in these requests for the FY15 budget, and we'll be hearing about if those are approved or not, probably within the next couple months. But tell me when you were thinking you were going to want to come in.
Well, this is where I like, yeah, I will come in. There's more slides left.
Okay, okay, this is the effort that I mentioned earlier about initiative that we started, we just submitted this in March. We put in for the seed grant funding for collaborations between College Park and Baltimore, and we put in a request for funds to start to develop a cohort of cancer patients to develop a survivorship cohort where we would identify patients and follow them long term and be able to study survivorship issues such as quality of life, as well as outcomes, recurrence, and mortality. And so this is a feasibility study. We're hoping that we will be able to extend the study to include the whole University of Maryland medical system, which includes the hospital in Baltimore, as well as, I think is it 13 or 16 other?
No, around the state.
Around the state.
There's going to be one here in PG County very soon.
And so for the feasibility studies, we're going to try to recruit patients in Baltimore and probably 2 additional hospitals. And we will collect data, survey data, as well as biospecimens from the patients. And we'll also get tumor specimens after surgery. And the purpose is to provide pilot data for a future grant submission in response to an RFA that the NCI has right now for cancer cohorts. And we've been talking to them, and they say they're particularly interested in supporting survivorship cohorts, and we think that we have a good opportunity here. And so this is our global health initiative, and it's in collaboration with the Institute of Human Virology of Nigeria. And this institute was established initially to combat the AIDS. There should be more on that? Yeah, I know it'll come. Combat the AIDS epidemic in Africa, but under the leadership of Drs. Blattner and Clement Adebamo. It's a hard name. The scope of the research has greatly increased, and it now includes cancer. And so this is just to show you a picture of one of the labs. It's a very modern facility, state-of-the-art laboratories. And they currently are developing a Nigerian cancer registry, as well as conducting research on HPV, the vaginal microbiome, and cervical cancer risk, as well as diet, genes, and breast cancer risk. Is this where you wanted to step in?
Sure. Challenges piece. Okay, great. Thanks, Joanne, for presenting on those pieces as well. So, I think any new program has, even if it's built on longstanding strengths, such as the work of, investigators with active research programs, I think we do face some challenges, and I'd like to get some ideas on, for interactive discussion on how we might approach some of these challenges. I think there are a great many strengths, and you've already heard about some of them, some of the active labs and research and centers and things so there are a great many strengths that will be brought to bear as we develop the population science research program, as we approach the Cancer Center submission for comprehensive status. So a great many strengths. The challenges, I think, will be a few that we are thinking very carefully about, and certainly would like any ideas that you have as well. I lumped a few of them around the umbrella of collaboration. We have a distance of 30-some miles between our campuses. And, sometimes that feels like an awful lot when you get caught in some odd traffic. I know it took, I came from one end of town to the other this morning, and it took an hour and a half, and so, you do have to engage in some planning around that. The other idea is one of using technologies to bridge those distances, and that's something that we're right in the throes of right now in terms of taking advantages of the technologies that we have available to connect with each other. That's something that I think we're getting more familiar with and getting more comfortable around, the idea of connecting and transiting between the campuses, and we're very fortunate to have folks from both campuses here with us today. That can, those commuting times can chew up a number of hours that are kind of spent in the car. So, the distance is a barrier, can be seen as a barrier. I think we, sometimes it's more getting our minds around it than anything else, between, I don't want to drive up there or whatever. Culture, and I bring this up with the idea that, me personally having spent time on a medical campus in my previous appointment and time, here on the College Park campus, they're very different types of cultures. You've got a campus with our School of Public Health, is kind of a 9-month type culture. And then you've got the preventive medicine and medical school type culture. It's a little bit different. And I think those things have a wonderful opportunity to come together and to engage in transdisciplinary research. Every now and then, you get a little culture, I don't want to call it clash, but you get a little culture difference where you're kind of standing there looking at each other going, hey, wait a minute, we do things, we do things differently on the campuses. And so, not sugarcoating anything, sometimes can be a challenge. And trying to integrate the two systems that operate differently sometimes. Operate differently maybe in terms of the way that indirects are handled or the way that, the post-award is handled. Trying to get secondary appointments through. I have no idea what is taking my secondary appointments so long up in preventive medicine, but, I figure it'll go through at some point, but, things like that. So there are cultural. And then the integration piece for the Cancer Center submission for comprehensive status, we not only have to show that we have a robust research program, but that we're, as a population science program, that we're well integrated, or that we're integrated, I don't even know if we're going to get to well integrated, but that we're integrated with the other programs. And by those I mean, this may be a lot of clicking because I didn't realize all this stuff was going to fly in. These programs, okay? So we have to show, and I put this in red because it's a new one, we have to show that we're integrated and doing research with these other programs. And so, how do you show that when, sometimes, when Joanne talks about, it's coming, when she talks about SNPs and GWAS, I'm sitting there going, not even sure what GWAS is, you know? And I'm gonna have to ask for an explanation on that later. So, you know, as a behavioral scientist, I mean, I'm truth talking. As a behavioral scientist, sometimes I'm going, microbiome, metabolomics, you know, so when you try to think about integration and how are these programs gonna integrate and collaborate with each other. And I think that's what we need to be doing. That's what a cancer center does. You know, you're among the other things, you're integrating and trying to engage in transdisciplinary research. So how do you do that? Anybody have any good answers around that? Anybody been at a cancer center where this is going on effectively? Go ahead.
My postdoc was at Moffitt Cancer Center, and at Moffitt, should I come up to the mic, or am I loud enough?
No, I think you're okay.
Okay,
Yeah,
good.
yeah. I think just go ahead and keep projecting. Yeah.
Okay, and so at Moffitt Cancer Center, they had the basic science research, the clinical research, as well as the population science. And from what I remember, it was a lot of collaboration amongst population, basic science, as well as clinical, and training programs were kind of the key. So a lot of training programs focused on exposing students to, you know, new curricula. Thank you. Whether it was in population science or basic science. So I know, for instance, the NCI has a R25 grant out right now that's looking at cancer education. And so that may be something that you all can apply for that can integrate, you know, training. Another thing was the advisory boards. So there was always an advisory board over the entire section, and that helped. It included key members from other cancer centers that had a comprehensive designation. So that's my input.
Outstanding. Fantastic. Thank you. Who else has some wonderful ideas to share?
I was just going to say we should bring Bowie State into our into this population program. So
Fantastic.
And there's a grant out right now that NCI has where,
yeah.
so we can talk.
So
Right,
we want to follow up on that because we do want this to be a campus-wide, larger campus issue.
Yeah.
Hi,
Mary.
my name is Mary Garza, and when I did my postdoc at Hopkins with the Cancer Center, they had a community, I don't think it was called Community Outreach Corps, but their community component then embraced the behavioral population science part.
right.
And that's how we were able to integrate into the Cancer Center. So
Okay.
I'm not sure about the Cancer Center, if it has a community
Oh, s-
component, the UMB.
Well, I think Mary is one of our members, and thank you for talking about that. I think a lot of the research that the population science program is doing is community engaged, like the work you're doing, the work I'm doing. But and we at UAB at our Comprehensive Cancer Center, we certainly had a very strong model in community engaged research. But in terms of how we're integrating with the other programs, I think that's an additional, you know, something to that we can bring in the community base to the additional programs as appropriate. But I think it's also challenging, you know, because we're working with people out in community settings, but then to put that around into a lab setting. So there's a lot, I think there's a lot of learning, you know, and engaging. Joanne and I will be attending the retreats. She had mentioned that we're going to be having our program retreat. We're targeting around June. The other programs will be having their retreats, so we'll be engaging with them and kind of learning more about what they do. Probably maybe Joanne has a better idea of some of that already than I do because I've been kind of down here and engaging around behavioral science. So, yeah. Pam.
Good afternoon.
Oh,
My name is Victoria from Capet State University. I have a concern. I have a niece that died at age 27 of colon cancer. Is there any of this program that will fall onto, because nobody ever died in my family with colon cancer or any other type of cancer. So where can we go from there?
Yeah, that's an outstanding question. And actually, my program and Mary's program focus on colorectal cancer. And we work, I only speak for my own program, we work in faith-based settings, educating folks about screening, but there is relative, and I also work in breast and prostate. Relative to breast and prostate, I see colorectal lagging behind significantly in awareness. But with regard to your question, I'm very sorry for your loss.
Yeah, because we
And-
all know colon cancer, there's an advice that at age 40 or 50 before they do colonoscopy. At that age, 27, nobody was even
Yeah.
going to think about colonoscopy. She find out through Dr. Oz on television, the signs and symptoms. That was the time she pushed it on her oncology to find out what I've reported all the symptoms. Why didn't they do a colonoscopy on me? By the time they did a colonoscopy, the cancer already spread.
Goodness. And that's a very young age to have a diagnosis of
Yeah.
colorectal cancer.
I mean, I think that from a medical point of view, anybody in your family should have a colonoscopy. You do. But an early case like that could be an indication of a hereditary predisposition, and people greatly benefit from that. So, you wanted to say something?
Transdisciplinary work is really hard. Yeah. I mean, in our center of our tobacco center of regulatory science, we have one of our R01s is on the microbiome. One is on EEGs of the head when people are using these new products, acceptability and abuse potential. And one is on toxicity, smoke chemistry, that sort of thing. So one thing we've done to try to lead from the bottom is have our postdocs rotate through all the labs. So they have to actually do rotations. And before they leave after 2 years, they're required to do a project that involves at least 2 disciplines. And that means that if my postdocs are working like that and working to understand the other languages and get comfortable with the other languages, then I better darn well keep up. Yeah.
That's a fantastic suggestion. I like that. Thank you for sharing. As I was going to pick on you again, but I already picked on you about the e-cigarettes, because I know you're an expert in transdisciplinary. Thank you.
Okay.
How are we for time? We have a few more minutes.
Yeah.
Okay, great.
One thing that I did want to mention, one of my goals is to develop a course in cancer epidemiology that will bridge the campuses, at least these 2 campuses, if not more campuses. I'm able to teach courses in Nigeria, so I should be able to teach courses in College Park.
I don't know. That's a
Although
challenge.
the IT people, I think, sometimes are not as attuned to that concept. But there are platforms where you can have the video of the audience and the video of the slides, and I would really like to also get an accredited program in cancer population research or cancer epidemiology, however we do it, within the system. I mean, as you know, this is a process that doesn't happen overnight, and to certainly make this a track in the current schools of public health, and as we go forward with the emerging joint school of public health, to make this also available for students at the master's level. Because there's really a need for trained individuals in the broad spectrum of population research, which goes from cancer control to cancer screening to palliative care to epidemiology to behavioral science. I mean, it's a very broad field. So it's a wonderful opportunity for our students and our faculty to bring their talents to the table. And so stay tuned. I'm hoping this fall to have this course co-taught by professors here at College Park and professors in Baltimore from their own classroom with their own students, with our own students, and have a joint classroom, a joint professors teaching the course, and maybe even pull some of our colleagues from over at NCI or FDA or other groups in the vicinity who bring a lot of expertise. You had something to say? So if you have students, keep us in mind.
Thank you.
My name is Marina, and I'm a master's degree in a student in behavioral and community health. And I have a question. I'm particularly interested in the relation between substance abuse and cancer, and in particular cannabis and cancer. And I was wondering whether, I mean, I didn't see the word substance abuse at all up there, and I was wondering if you could speak a little bit about that. Is this something that you consider or not, or have interest in at all?
Well, that's a good question, especially now that we've apparently legalized possession of small amounts of marijuana here in Maryland. Yeah. You know, I don't personally know anything about it, but I have noticed in the last week we've got a couple of new program announcements or something, or funding opportunity announcements through NIH, and I did catch the word cannabis in the titles, but I don't know if they're related to cancer, nor am I familiar with the literature in that area. But it would be an interesting area to explore. I don't know if others in the audience may be aware of that literature.
Our research areas for this presentation are fairly broad because we need to establish groups that have certain number of investigators, et cetera, et cetera. And so, although you don't see something like substance abuse, research on alcohol is associated with a lot of cancers, research on alcohol, and cancer, cannabis and cancer, that would all fit. We would make it fit somehow. It might not be an exact fit, but we could make it fit within our program. And so if somebody were doing that kind of research, we would find a place for them in our program. And until it, like even some of the programs we're still organizing, and we might break some of them out a little bit more. But we have to see where our members all fall once we get our full group of members, and then try to organize into cohesive groups, but also figuring out how to get people the best fit for them.
And just in terms of the specific issue, I think you have to approach it in this way that Dr. Clark identified. It's really a multidisciplinary issue. And so depending on how the cannabis is used, whether it's ingested or smoked, in a smoking environment, there probably need to be, and I don't know the literature, studies of the benzopyrenes and other compounds that are formed when you burn organic material. They become highly oxidative and intercalate into the DNA, and one of the ways in which smoking causes lung cancer is through the effects of these benzopyrenes and other chemical carcinogens. And so there's a chemical carcinogen piece, and then there's a pharmacological piece from the point of view that these psychoactive drugs impact a lot of pathways that can alter inflammatory states, and inflammation is an important emerging field for promoting an environment that would support cancer cell surviving, for example. And the reason we figured out cigarette smoke was involved was that during World War II and earlier, there was this huge cohort of people that started smoking. And Sir Richard Dahl did a epidemiologic study in the UK thinking that it was related to the contamination being caused by this proliferation of tar-based roads. And tar had been previously identified as a component of certain cancers, scrotal cancer and so on and so forth, from the chimney sweeps and so on. And so his questionnaire had all these questions about how far you live from the road, and he threw in some questions about cigarette smoking. And the cigarette smoking gave risk ratios that were off the chart, and he deserves a Nobel Prize for his discovery. And so part of the problem is that when you have underground use or intermittent use of these psychoactive drugs, the ability to link exposure to cancer is much more complicated. And so the next phase of cancer epidemiology is going to use genomic markers of exposure, for example, as another tool for replacing questionnaires, especially when you're asking people about illegal substance use. They may not be totally forthcoming. So it's a big challenge, but I think it's a fruitful area, especially as there's a rapid push for decriminalization and legalization of marijuana use. So you're into the right place. You may be a little bit early, but you'll probably be able to be very successful if you can get on the front edge of that. Yeah.
One more suggestion. I know at Moffitt they also gave internal grants for collaborators. So maybe that's something else, you know, in bringing in the new population scientists, provide some type of internal grant for them to form collaborations with the basic scientists or the clinicians. And then also part of like a grand rounds seminar, bring in groups that have collaborations so that they can talk about them.
Absolutely, and Joanne had mentioned the pilot grants, and we would have emphasized the transdisciplinary and the collaborative impetus on those grants. And she had also mentioned the seminar series, and though we're not calling it Grand Rounds, that will be a monthly series, and our first date is April 21st from 9 to 10 a.m. And that's in our School of Public Health building. If folks are interested in attending that, please, get with me. We need RSVPs on that for the breakfast. And we are doing distance collaboration with the video technology on that from the Baltimore campus. So please get with one of us so that we can get you in the mix on that. We will have the monthly seminar series and the retreat coming up around June. Seed grants are going to be coming up. And, the population program, we are up and running. We're developing. There's, the train is not left the station. We're calling folks aboard who are involved and interested in population research around cancer. So please, get with us, and we're willing to opening collaborations, and the doors are open, and we want to invite you to join.
So maybe we can leave a piece of paper up at the front of the room for anybody who would like to be on the email list and get more information. We'll just stick a piece of paper and a pen up there and get everybody's email and get the information out and get you on the train.
If you got an email from either myself or Cheryl about the April 21st meeting, you're on our list already, so you don't have to sign up. But if you are, we did not mean to not include somebody who we did not invite. We just did not know that we were interested in cancer research per se. So please, we do want to invite you, and we do hope you'll come up and if you just leave your email address as well as your name, we'll be in contact with you. Thank you.